So in this section, we thought it'd be useful to talk about kind of the diagnosis of anxiety and depression, when you might recognise it, what the signs might be for a carer.
Yeah. Very often a carer, a partner, mum or dad, are the first to see the patterns of depression or anxiety, because they're seeing the enduring nature of it despite different situations or different activities. Their husband or wife, the son or daughter remains depressed or remains anxious.
So sort of on a week by week
basis.
This has been going on for a while.
Absolutely.
This is something that's not sort of bouncing back.
Yeah.
Okay.
You know, it's not just when they're at work, it's also at the weekend. It's not just when they're around Christmas time, it's other times of the year. So they see the enduring pattern. That's one of the first things. And as someone who cares for a loved one going through these difficulties, your natural inclination is to reach out and help, and that is important, and we don't value that enough. But the single most important thing I believe a carer can do to help someone is to get them to access professional help.
Okay.
Because the help that can be provided, all the evidence shows it will help. It's not just to protect them, it will actually improve their moods or their feelings about things. It will take the burden off you as a carer in a very clear way. And very often, when a person suffering from depression or anxiety or both is able to access care, it will generate a plan for that individual, and that then gives a frame of reference for the carer to target their support and to schedule it in the right kind of way.
So if you're caring for someone and you start to think that there might be this might be ongoing basis, that the depression or the anxiety is getting worse. How do you sort of go about those kind of conversations? 'Cause I imagine those are difficult conversations to have with someone if they're not necessarily recognising that in themselves.
Absolutely. I guess some of the risks around this situation is not wanting to have the conversation at all, in case it might upset the individual, or you're not confident about what to say. And in that situation, I would say you can feel confident. The conversation isn't a complex one. There are no words to avoid. It's much better in the longer run that you explicitly say, look, I'm worried that you are really worried about a certain thing, and that's ongoing, and you seem to have a lot of anxiety. Do you think it'd be worth speaking to someone, for example, the GP? Okay. Right? You can be very direct about that. There are different ways of managing access to professional help. My general guidance on this would be that unless there's a really good reason not to, start with a GP.
Yeah.
Why? Because, as you mentioned earlier, quite rightly, very often anxiety and depression occur in the context of ongoing physical illnesses or other challenges.
So they've already got a relationship with the GP.
Relationship, yeah, absolutely. Yeah. Even if it's not necessarily a live one right now, clearly the GP has all the records. It's also important because the evidence shows that antidepressants and anxiety management drugs are effective. So, and in particular, I'm a cognitive behavioural therapist, and the research shows that the best combination is antidepressants or anti-anxiety drugs alongside psychotherapy. They do work well, they bounce off each other. So having one of those two approaches on their own will be better than nothing, but it's better to have the two together. Okay. Now, the difficulty is that, as I'm sure everyone's aware at the moment, although there's been attempts to improve access to psychological therapies, when you go to the GP, normally you're looking at a waiting list time of between 3 to 6 months, maybe
That's
more.
in terms of getting a talking therapy.
In terms of getting talking therapy. So several things can happen there. First of all, the GP can put you onto the list and you have to wait, but they might well prescribe antidepressants or anti-anxiety drugs on the spot. And there are different types of those, and we can talk more about that. An alternative which can be accessed is there are now many charities who offer very high quality, professionally supervised psychotherapy, and it's free. You can make a donation, but it's free, and you will be seen by someone who's maybe an experienced psychotherapist. You might have someone who's qualified at a basic level, but training for higher level qualifications. And you should be able to access that kind of service within maybe 3 or 4 weeks. Okay. So the waiting time is a lot less.
Just to go back a step though. So you're having the conversation. You're it could be a family member, it could be someone you're in a care relationship with, or and you're starting that conversation. As you said, there's no right or wrong. You say, look, I'm a bit worried about you. Your mood doesn't change. What if they go, well, no, I'm fine, or this isn't something that I want to talk to anyone about?
Yeah, well, ask twice.
Okay.
You know, sometimes the person who's suffering is aware that their suffering is visible, and they know it's impacting on other people. So it doesn't come as a surprise when the carer says, look, I think you need to talk to someone about this. What do you think? It's not a surprise. The alternative is that the individual is kind of aware that they do need help, but they're very reluctant to access it because they don't want to talk about the thing which is really troubling them. And they may have had negative experiences or heard of negative experiences of others in terms of speaking to the GP about depression, or speaking to a therapist about their past.
And that's something I've come across when I've had friends, particularly with anxiety, where they will say, well, actually, if I go and see the GP about this is going to happen, they're going to put me on these meds, it's going to have this effect on me, I might lose my job, and they start a train of thought that's gone to a worst case scenario, particularly if they know people who've had very negative mental health experiences, and they think, I don't want that to happen to me.
And that's very understandable. We have to respect their views about that. I think the general view has to be that if you can encourage the individual to take just the next step, and to make sure that they understand that they are in control of their own care. You're there to support and contribute as requested or as necessary. But at the end of the day, it has to be up to them. You can't and should not make a person go to the GP. But I think if it's presented as being, look at the statistics, more and more people are going to GPs now just to have these conversations. GPs are much, much better trained to be tactful and to be informed about these conversations than they were very recently. So you have every reason to believe it will be nowhere near as difficult an experience as you might think. And in particular, you're not committing to anything. You're not committing to taking any drugs. You're not committing to seeing any therapist. You can decide what you want. Rather than go chasing around the internet to find out what some people are saying about some aspects, go to the GP and she or he will tell you, these are your options, this is what the consequences might be, this is the timeline, it's for you to make a decision about what you want to do.
And I think that's really important, that it's always that person's in control of the process.
Sure.
And one thing that I think, I'm not sure necessarily all GPs do, but I think it's now considered a very good practice. They'll often administer a questionnaire. They might ask a number of questions and actually just say to someone, well, look, you're actually scoring quite high on this questionnaire. Can sometimes help people think, oh, okay, I'm now associating a number of things. Yes, I've been low for a period of time, I'm not really seeing any joy, I'm having kind of these kind of thoughts. Oh, okay, right, there might be something here that I can have some help with. Yeah,
absolutely. Normally now within the British NHS, the two questionnaires or scales that would be routinely administered are what's called the PHQ-9, which measures levels of depression. It's a basic screening instrument. It takes like 5 minutes to complete. And the other one is the GAD-7, which measures anxiety. And it's symptom based. They ask basic questions about how often in the past 2 weeks have you had trouble eating or eating too much? How often in the past 2 weeks have you had trouble sleeping? Do you feel that something awful is about to happen? And it will also, on the PHQ-9, have question number 9 is, have you had any thoughts about ending your own life recently? So it deals with that, but that is a general principle that there's nothing problematic about raising that aspect. If you are someone who's suffering, if you've had any thoughts of ending your own life, then you should raise that with your GP and with whoever else you think needs to know.
And we're going to do one of the modules specifically on suicidal thoughts. So if that's something that you're encountering, there's going to be a specific kind of module about that.
Absolutely.
So I suppose we're talking a bit about sort of the GP, and what would you what would someone expect from their kind of first meeting at a GP?
Okay.
And often, and it can be quite helpful if you're the carer, say, well, look, can I come in and see if the person's helpful? So certainly if the person's open to someone coming in with them, it can help because you can also fill in things, and particularly timescales and things like that.
No, absolutely. Once the individual has said, yeah, I'm going to go to the GP, they might want to do that on their own, and you should respect that. But you're absolutely right. Either for the first consultation with the GP or for a follow-up one, it's good if you as the carer can be there. There are many benefits. First of all, it shows your commitment to their well-being, which is important. Secondly, we know from research that no matter how attentive or how focused the individual is in the consultation, there's always details they forget, yeah? There's always things there. But also, often the GP can give broad guidance on how a carer might be able to contribute to the recovery or the protection or just enhancement of mood of the individual. So it immediately gives the carer a chance to understand what their role might be in helping. So there's all of those good reasons.
One useful tip that people might find is certainly when I've gone in with a family member, I will say to the GP, is it, I'm this person's carer, I'm a family member, is it all right if I sit in? 9 times out of 10 they will turn around to the person themselves and say, well, it's up to them, are you happy? And they check that person's happy. And then I say, look, if you want me to leave at any stage, if you want to talk about anything more sensitive or family connection, I'm more than happy. And sometimes that can just help people feel that the person you're going in with is completely control of the conversation, and that you're very happy to step out if that's helpful.
Yeah, absolutely.
So, yeah.
No, you're absolutely right. I would just mention here that in situations where a child is wanting to speak to a GP or someone medically qualified, there can be a degree of reluctance on the part of the child to have the parent in the room, and the parent might feel, gosh, why are you excluding me from this? Got to be careful not to read too much into that. One of the key reasons is that the young person doesn't know how the parent's going to react to some of the things that he or she would want to tell the GP. So compared to, say, a husband or wife or partner who might have been with you as a carer for several years, they kind of know how you might have already have spoken about the issues, so there's no new information. But a young person may have kept certain things to themselves, and they need a little bit of space just to share that with the GP, and they want to take some time to reflect before sharing it with you.
I hope you found this course helpful. At FCC, we're committed to providing courses and training for unpaid carers, and these courses are completely free. If you found this helpful, you could support our work in 3 ways. Please recommend it to any friends or people that you know that will benefit from the courses. Please consider sharing it on social media. And if you can, please consider donating. There are buttons on the website where you can donate £1, £2, £5, and every pound that you donate will make a huge difference by helping us make more and more care courses completely free to carers. Thank you very much.